We are back with another episode of the Well Balanced series. Today I'm super excited to talk to Dr. Kristen Oja, who is a old friend of mine in particular, but she lives in the Atlanta area with me and is just an awesome functional medicine provider in the city and definitely just knows a lot about this topic in particular. So I'm super excited to talk more about this whole new revolution of health with her. So I'm going to add her into this conversation and we'll get started. Always tricky getting them in here. Let's see. There we go.
Hello.
Hi.
Out of the patio. It's such a pretty day.
It is. Oh, it's so humid though.
Oh, I know. This heat. It's intense. But I'm so excited to be here with you. I'm trying to figure out this camera situation.
I know. Whenever you share, it like moves you around a little bit. So
okay.
No worries. Okay.
Is this
good?
Me?
Yes. Perfect. But how are you doing? Happy belated birthday, by the way.
Oh, thank you. Yeah, I'm doing great. Cameron actually spoiled me yesterday with a birthday surprise. So I had a spa day, which is a very abnormal Monday. I'm usually seeing patients. So it was special.
Oh, good. And then you were at the beach. You had a second wonderful, beautiful baby. So lots of things happening for you.
Oh, yeah. It's a busy time, but it's a fun time. We opened our second location. So I have, my two businesses and my two babies. And my businesses feel like my babies. So yeah, there's four of us. And
I love that. If anyone can do it, it's you for sure.
Yeah.
So never question that. Well, I appreciate you being here with me and discussing your passion, of course, this topic, I'm sure. But really just wanting to kind of share with the audience and just my audience, your audience, everyone, and just kind of continue to spread the word about functional medicine in particular. Obviously what it is and what the point of it is, how we use that as an alternative method to healthcare and all that kind of stuff. So let's start out with an introduction. Definitely want to know kind of like obviously more about you and what got you into this space. And your story as a nurse, I think is super awesome and fascinating. So would love to just start there.
Yeah. So the story's kind of long, but making it short, I started my career as a personal trainer, and that's what I wanted to do. I was going to be a personal trainer forever, and my parents were like, Kristen, just graduate with some degree. Whatever the degree is, just like finish school. And so I met with different people, and they were like, if you go nursing, you can always find a job. And so I went nursing, and I actually hated it at the beginning for a while. I was in the dialysis unit with fluorescent lights and no windows, and it was so dark. If you guys don't know about the dialysis unit, people sit in there for 4 hours and get their blood filtered because their kidneys aren't working. And I sat in there and I was like, how can I be this light and how can I do wellness? I'm this personal trainer. I'm bubbly. I'm high energy. And then I'm in this fluorescent dark place where my patient's kidneys aren't working. And I just realized I wanted to get on the other side of things. I really wanted to get into prevention before they were in the dialysis unit. And I really preach, and I know you do too, Kelly, but I really preach this little by little, a little becomes a lot. And how, it's not this earth shattering where you have to go autoimmune paleo for the rest of your life and never go out to eat to achieve wellness. And so I got my master's, then I got my doctorate, and then I worked in integrative medicine, and then ultimately opened Stat Wellness. And then my certification is through the Institute of Functional Medicine. And then I'm working on my fellowship through A4M right now, which is probably going to take me about 5 years. And A4M is a anti-aging functional medicine longevity certification too. So long story short, but that's it.
Yeah, I love that. So like when you were nursing and things, I mean, like I'm sure that perspective was so crazy. Like you said, not the prevention route. They take a very, what's the other word? It's not preventative, it's reactive. Is that it?
Yeah. I tell people as a culture, and I never want people to think conventional medicine is bad because I'm so thankful for it. We live in a country that has, the best oncologists, the best cardiologists. Like we have access to all of this. But we really are very good at sick care. Like as a country, it's not healthcare that we're doing in the hospital, it's sick care. And I appreciate that and I value that, but we've got to look at how can we put the emphasis back on healthcare.
Absolutely. And one of the questions that came in yesterday was, is functional medicine always the most effective route? And I think people are always like, it has to be one or the other, where I think a middle ground is really what your perspective has always been. And I appreciate that because there's nothing wrong with the conventional way, and there's a lot of awesome things about it. And of course, there are situations where you have to use it, right? But at the same time, we still have to learn how to prevent and hopefully reduce and eliminate some of those things for the future. Otherwise, we're going to be in a horrible place.
And that's how I always start my visits, even with my patients. I'm like, we value conventional medicine. So this is not an either or, exactly to your point. Like if my patient has a bad sinus infection, I'm going to put them on an antibiotic and like prescribe that. But I'm going to at the same time talk about, can you take Saccharomyces boulardii to prevent any kind of yeast overgrowth, protect your gut when you're on these. Now let's work on rebuilding afterwards. So there really is this middle ground that needs to be met. It's not all integrative and it's not all, Western medicine.
Absolutely. Okay, so let's explain again, the prevention obviously is kind of the main keyword I feel like in functional medicine, but kind of what is this approach? What is this new thing that we're doing, and explaining that a little bit more.
So I think one of the big things with functional medicine is really uncovering what is the root cause. And in order to figure out the root cause, we have to go all the way back and really understand your health timeline. So when we meet with our patients, we spend an hour talking with them about what was your birth like? What was your upbringing? Were your parents married? Did they divorce? Did you have a lot of test anxiety growing up? Were you put on stimulants for ADD, ADHD? Were you somebody that was allowed to have, 2, 3 Cokes every single day growing up and you lived off soda and Kool-Aid? We want to know all of these things because they impact our health today. And it's amazing. People are like, oh, I've never thought about what my birth history, I never talked to my mom about that. I don't know if I was breastfed or not. I have no idea how many antibiotics I was on. And so we really help uncover what that root cause is, because in our opinion, if we can address the root cause, we're not just managing the symptoms for the rest of our life. And for example, basic things, high blood pressure. If you don't understand why you have high blood pressure, you're going to be on blood pressure medicine for the rest of your life. You will not get off that blood pressure medicine if we don't look at how is your lifestyle playing a role. Maybe do you have sleep apnea? I can't tell you how many times my patients have had sleep apnea and they snore every night, and that's the driver of their high blood pressure, and they're put on medicine and their sleep is never improved. And what do we know is the most important thing? Our sleep. So if we're not getting good quality sleep, it's not just going to be our blood pressure. It's going to impact our hormones, our gut health, our inflammation, our longevity. Our life will be shortened if we're not sleeping well. So that's just an example of how we look at root cause medicine.
I love that. Yeah, and I think that I'm excited about the future. I think that's really where people are headed, and I think people are starting to ask a lot of questions and not be comfortable with the normal, and I think that is something I'm sure you see every day, but really exciting stuff that people are, wanting that information and wanting to dig deeper. So like, what are you kind of touched on a few right now, but just other big symptoms that you feel like are kind of like the overarching ones that you see within the standard American diet and things like that. Yep. And then kind of what your typical go-to recommendations or protocol would be, or lifestyle.
Yeah, so we see a lot, with functional medicine, and because we're all family medicine, we even see children. So, in the children, a lot of what we're doing is eczema, gut issues, ADD, ADHD from functional medicine lenses. We work with a lot of adolescents and young adults, a lot of women. So we get into a lot of hormones, the birth control method, like how can we optimize your hormones naturally. We see a lot of PCOS, which is not a surprise considering 1 in 10 women, which I believe the statistic's even higher. If you look at, we believe PCOS falls on a spectrum. So you have like full-fledged PCOS and you have a lot of people in between. And so we look at, that continuum. So we treat a lot of PCOS. We treat a lot of acne, even if it's not hormonally driven. So foods and gut playing a big role. We treat a lot of autoimmune disease. Depending on the degree, we probably work with a rheumatologist and us through functional medicine, but we try to uncover what is the root cause of the rheumatoid arthritis, the Hashimoto's, thyroiditis. We look at that. We do a lot of just wellness and prevention. So people that feel good, but want to feel even better. Like nobody has done a whole blood panel on me. Like I have no idea, what is my vitamin D? What is my B9? What is my B12? So we really treat the whole gamut. A lot of what we do in functional medicine goes back to the gut. So I feel like I'm talking about the gut like single day, all the time, because it's so important. It's where our immune system stems. It makes serotonin. It helps with absorption of nutrients. It's how we detox and eliminate. So we go back to that a lot. But in functional medicine, when you really look at any of these complaints, it's really one of a couple systems that's off. It's either your gut is off, your hormones are off, you have inflammation. Those are the big ones. You're not detoxing well. You have nutritional deficiencies. So we can kind of start to put the pieces together based on your timeline. And then normally we're working through gut health, hormone balance, stress management, all those things that are going to play a role.
Yeah, no, I love the big picture. And I think it's also, like you were saying, some people that are even healthy just want that perspective. And, it's also, but healing isn't linear, right? Like we go in these ebbs and flows all the time, and you might have had a really healthier space, but also if you're a certain size, doesn't necessarily mean you're healthy. So it's always just good to have the blood work and things to kind of tell you and just to zone in and really be clear onto what you kind of can focus on. Because I think it can be very overwhelming with people that don't know this type of information, and then you
Yes.
throw them in and you're like, all these changes, and no one knows what to do. So I
And
love
it's
that.
mentioned, like it changes so much different seasons of your life. As you were saying, like health is not linear. So for me, even I was wearing a continuous glucose monitor postpartum while I'm nursing. So I have a 3-month-old at home, and I need so many more carbohydrates right now than I did before. Like my blood sugar was
Right.
dropping all day long. And so having that data and being able to say, I need more like sourdough bread and sweet potatoes and bananas, and I need to be eating, like the other day I ate a sourdough bagel and my blood sugar, barely went up, and I had so much more energy, and it's what I needed. And so it is not linear, and it changes. And that's why it's so nice to have a partner in your health that looks at those changes and is able to kind of tweak your plan based on the season of life you're in, because it varies a lot.
Yeah, no, I think it's definitely because even or I even went into it in a mindset of like, I'm gonna heal this up and be good to go, and even as I've learned more about gut health in particular and things, that's a everyday thing. We have to be doing that constantly because we're just in a constant culture that with stress and with, antibiotics and all these other things that are happening, that it's not going to be a one and done type of deal in this, and especially during the different phases of your life and the different times and nutrients that you need, you're always going to be changing. So I think having access to people that really invest in your health and know your story is so important and can see that progress with it. But there were some, there were 2 or 3 symptoms that kind of came in pretty regularly that people were kind of curious about. So one was hair loss. So we'll
Yep.
start with that one in particular. I'm sure that's a common one. What is typically happening in that situation?
So hair loss, there's a few different reasons for it. I typically see one of 3 things when it comes to hair loss. So a big one, it can be inflammation. So a lot of times autoimmune is going to cause some degree of hair loss. So we always want to look at inflammation and see if that's the root. The other big root I see is nutritional deficiencies. I see a lot of nutritional deficiencies causing hair loss. And then the third bucket is hormones. And we can kind of break these down more. But hormones could be thyroid issues. So we do see a lot of, sluggish thyroid, slightly imbalanced thyroid playing a role with hair. Normally that's going to be your hair, your eyebrows, the hair on your body as well, not just hair loss on your head. But
Right.
we see androgen excess is a really big common one we see. And that androgen excess is anything from high testosterone to high DHEA or one of those metabolites. And that we see a lot with that PCOS or polycystic ovarian syndrome. So it's usually either inflammation. So we'll check blood work to look at that. We also assess for other symptoms. Are you having joint pain? Are you having other skin issues? We'll look at that. We look at nutrients really specifically. I want to see where your protein levels are at. I want to see where your iron level is, and not just your iron, but I want to see your iron saturation, your hemoglobin, hematocrit, and ferritin, which is your iron stores. A lot of women's iron looks okay, but their iron stores are just so depleted. So every time they menstruate, they don't have those stores to replenish. And so they have a lot of hair loss. Normally, if it's a iron deficiency hair loss, you're going to have other symptoms too, like cold hands, cold feet. You may notice your tongue is pale. If you pull your eyes down, you may notice the redness of your eyes are very pale. Those are signs of iron deficiencies too. And then, of course, the hormones, we're going to look at a thyroid, not just the TSH. Like we want to see the whole picture. And we also want to look at Hashimoto's, which would go with that autoimmune. And then we look at testosterone free in total, and we're going to look at DHEA.
Okay. Perfect. Yeah. No, I think that also the lab work, I think, is confusing. People ask a lot of questions, or they'll say, oh, I got my lab work done and all this stuff. And then of course they'll look at a very blanket number of things. And then also the numbers are always normal. There's never anything wrong. And it's just kind of something that I'm always encouraging people to go to a functional provider and really get the full panel.
Yes.
And so actually to bounce that question, can you explain kind of the difference in what a typical blood work versus what you guys offer and how that, what you would recommend there?
Yeah, a lot of what we do is through LabCorp, which one of the biggest lab companies, and we do process through insurance, but a few different variations between us and conventional medicine. One, we don't do the same standard, like once a year panel on everybody. So everybody's labs look different based on our whole health timeline we've gathered. I may want to check somebody's mono or Epstein-Barr virus markers. I might want to check somebody's candida or yeast markers. I may want to look at somebody's autoimmune deeper. So we custom make our panels based on our patient's story. So it's not always the same. And we look at a lot more. So we do use diagnosis codes and run it through insurance, but we also have our patients understand, like, we think it's important to look at this whole panel. You may get a lab bill. This may not be covered 100%, because I feel like that's part of the reason with physicals. They're like, we know this is covered at 100%, so this is all we run.
Right.
And like a vitamin D, I've had so many patients be like, my provider won't run a vitamin D on me because they said it's not covered by insurance. Well, we value that, and we're going to put as many codes as we can to help, but really important to see that in your story. So they're all custom. But the other really big thing is it's really important to understand reference ranges, and reference ranges are just that. They're reference ranges. And really how we came up with reference ranges is we put everybody in a bucket basically, and we put them on a bell curve of people's levels. And we said this 2% is abnormal and this 2% is abnormal. And all this 96% is going to be our reference range. And is that a healthy population? Are we as Americans and our levels, are we a healthy population? A perfect example of this that's actually just even been through me practicing is the marker called C-reactive protein. This is a marker of inflammation that to us is a big driver of every disease. We know if you're inflamed, you're at higher risk for diabetes, Alzheimer's, autoimmune disease, everything. The range when I started practicing, 8-9 years ago was 0 to 5. That was our reference range. Well, everybody is so inflamed in America. Levels are coming back higher and higher, but they're not sick. They're not sick people.
Right.
On a bell curve, this 2% is abnormal, this 2% is abnormal. Now our reference range is 0 to 10. So you could have a CRP at 9 and you're normal, where that is not normal. That's a lot of inflammation, and that's going to increase your risk of disease. So we don't look at reference ranges. We look at optimal, and it varies depending on what lab we're looking at. And we don't do just the standard once a year panel. We customize it to you and dig deeper to figure out how are your adrenals functioning. We want to see the whole picture with your thyroid. That's a big one that people talk about in functional medicine a lot, because it's, conventional medicine really looks at a TSH, which isn't a bad marker, but that's just how is your brain talking to your thyroid. Well, we want to see how's your brain talking to your thyroid, but I want to see how your thyroid's working. I want to see how's your thyroid making T4. How is it converting T4 into T3? And if we're not looking at this whole communication and thyroid output and then how our system is working, your liver even plays a role with T4 to T3 conversion. You need optimal nutrients to help with that conversion. So we have to look at the whole picture, and we can't just look at the, starting point of how your brain's talking to your thyroid and determine if your thyroid is working.
Right. What are, for someone just for education purposes, is the full thyroid panel that you would want to have?
So typically we're always on every single person checking a TSH, a T4 free, and a T3 free. Depending on the person, we may add a T4 total, a T3 total. We may add a reverse T3 to help see that T4 to T3 conversion. And we may run thyroid antibodies to look at Hashimoto's. We can get into some other antibodies. We can get into thyroid binding globulins, but usually a TSH, a T4 free, a T3 free is a great place to start, so we can at least see brain to thyroid communication, T4 output, and the T4 to T3 conversion within your body.
Okay. Yeah, that makes sense. Yeah, and I think people have gone to their doctors and they challenge them, and they say that they want these tests run, and sometimes they get a no and they won't do it. And it's crazy that people have to seek out people that will, because you deserve to have that information.
Yes.
But it's just the world that we're in. Okay, a few more questions. So then on another symptom, you kind of touched on it, but very common is PCOS. So just kind of breaking that down a little bit more, hormonally and all of that kind of thing.
So PCOS is also really unique in the fact that it's not all the exact same. So conventional medicine, PCOS is polycystic ovarian syndrome. For those of you guys that don't know what it is, it affects up to 10% of childbearing age. I really, again, believe that statistic is higher. But things that go into this PCOS is anovulatory cycles, meaning you're not ovulating every month. So your cycle is irregular. Excess androgen. So you have acne, body odor, unwanted dark hairs on your head, on your face, on your chest, but then you have hair loss on your head. You have oily skin. And then normally it goes with insulin resistance patients and cysts on your ovaries. But you don't have to have every single one of those things in our world to be on the spectrum of PCOS. You could just not be ovulating, and it could actually be adrenal driven PCOS.
Mm-hmm.
So
Wait. Can't hear you. Yep, I can hear you now.
sorry,
Yes.
I probably should have said. I'm like so new to these live things. I'm like, I should have put my phone on flight mode. Where did I cut off? Where I was talking about insulin?
Like 10 seconds ago. I was
Okay.
like waiting to see if it would come back.
Okay. So with the PCOS, we talked about the syndrome. I think you guys probably heard the symptoms, but it's not all the same. So a lot of PCOS is insulin resistance driven. So we have high blood sugar, and it really makes our ovaries not ovulate every single month, and it causes more of those cysts on the ovaries. So insulin is a big, big driver of PCOS, but not for everybody. I have people come in and they don't struggle with their weight, and they actually have low blood sugar throughout the day, and they still have PCOS. And it can also be what's called adrenal driven PCOS. So stress is a big driver. They could have really high DHEA, which is an androgen, and that can impact your body's ability to ovulate and that PCOS.
Interesting. Yeah, no, I think that the hormones obviously play a huge role, but it's like, and I think lifestyle can just, again, balancing your blood sugar and getting, those things in order can make a huge difference.
Oh yeah.
And getting the metabolism just functioning optimally. But I think it's scary how common that's being prescribed when people are so range on the spectrum in that sense.
Yep.
But there's still hope. I love that there's still hope.
For sure. And we have such great success with PCOS and helping with fertility and getting people pregnant. I think this is an area that functional medicine does so well with when it comes to fertility, is really working on that PCOS from a natural standpoint. And yes, blood sugar control is really important, but keeping inflammation low, managing the stress, all of these different things. And then we do use, like I always describe our method as a pyramid. So like when we're thinking PCOS, that lifestyle is the foundation. So,
Right.
if there are certain elements of your lifestyle that you're not doing, it doesn't matter what supplements you take or what hormones you take, right? Like we've got to think of that base first. So we're going to always put emphasis on that lifestyle, but there are supplements that support it. When we're talking about PCOS, inositol is really helpful. Optimizing vitamin D, chromium, Vitex. We have a lot of these natural options that are in that second tier. And we do use medicine. I mean, it's amazing to me how powerful metformin can be for somebody with PCOS when you work on that insulin component at the same time you're working on the lifestyle. It's helped a lot of people ovulate and be able to get pregnant. And metformin is used a lot more in the anti-aging and longevity space now because of its effects on mTOR and our brain health and longevity. So it's, there's so many options. And again, it's not just, you got to do this. This is the path. This is the protocol. We have to customize it to you. And we always meet our patients where they're at. Like I have some patients I work with and they're like, Kristen, I don't have the time to do all these things right now. I really just I want to be on birth control. It controls my symptoms. I want to be on this. I know it's a Band-Aid. I know I'm just covering up the symptoms, but this is what works for me with my lifestyle right now. And I support that. And then we have other people that are like, I want to do everything I can naturally. I have the time, the motivation. I'm going to cook every meal. I want to do what I need to do to cure my PCOS through lifestyle. And so we really meet people where they're at. And if you're not comfortable taking metformin, I'm not going to put you on metformin. We could do berberine instead. And so it's just, I always say we're as unique as a fingerprint. You guys probably know that and have heard of that. But what works for one person or what works for Karen next door is not necessarily going to work for you. And that's really important.
Yes, I love the bio-individual approach. And I think that, again, getting someone's real story and diving deeper is so key. And then the birth control thing, it's like you have to just go with where people are. And I think that that's really awesome that you guys do that. Okay, so two final things. First one is your maybe like 2 or 3 myths that you used to believe or learned a lot during your schooling that maybe you don't believe now, or you see a lot that people believe in the health space that's obviously incorrect. And then also your 2 or 3 top tips if you were to say for somebody to start their journey currently, what would be priority?
So let me think. One of the myths that immediately came to my mind is when I was in school, I was taught to assess what my patients' normal bowels were like. So if they had a bowel movement every third day their whole life, they're normal and that's okay. And that is like a huge myth. It's like, no, we need to be having regular daily bowel movements. It's our way of detoxing and going back to our gut health. So I just think that's hilarious. And they're probably still teaching that in school, honestly, is assess your patient's normal. So if my
constipation is cool.
Is that okay? Is it okay to just leave them having diarrhea every day? So I think that, we need to go back to the Bristol stool chart and have daily bowel movements. And it's a really good indicator. I think the other really big myth I hear all the time is, well, I want to take birth control because I want to have a period every month. And when you are on birth control, it is not a period. Like, I think that's a huge myth that we get all the time. When you're on birth control, it's what's called a withdrawal bleed. Your ovaries are not making their own hormones and you are not menstruating. But patients really like having that, bleed once a month because that is their cycle, and that is not their cycle. It's a withdrawal bleed. So that's another huge myth that I hear. Let me think of a third myth that I hear all the time. I feel like the really cheesy myths are really getting out. Like we're now, I feel like I don't have to convince my patients anymore that fat is good. Obviously this is a big thing that we have all talked about for a long time. I think the big place that we're at now, and I don't know your opinion on this, but I feel like from a food standpoint, my patients are still very carbophobic. And they still think carbs are bad. So like now we no, fat is good. We feel good about eating fat, but now carbs are bad and carbs are the enemy. And I feel like that is a big thing that I'm seeing put a lot of stress on people's adrenals and thyroid because they're going so low carb and they're over exercising. And so I think, we need to remember that no macronutrient is bad. We need the carbs, we need the protein, and we need the fat. These all have different benefits in our body. So those would probably be some of my three myths. And then my tips, I go back to the little by little, a little becomes a lot. I always go back to the pyramid and I would say, take an assessment of your own lifestyle right now and look at your sleep, look at your stress, look at your diet, and look at your exercise. And which one of those areas do you feel like you have the most room for improvement? And most of us can look at it and be like, okay, I am really practicing sleep procrastination, which, by the way, I love that we finally have termed this. Washington Post termed it the sleep procrastination, which you guys may relate to this, but it's when people don't have time for themselves. So at night is the time that they have to do whatever they want to do for them. So they procrastinate going to bed so that they can, watch their Netflix, read their book, do all the things that are good for us. But that sleep procrastination is real because a lot of people have that responsibility and they have to get up at a certain time in the morning. So I would look and see if yours is sleep, then start by just saying, 30 minutes. I'm going to set my alarm to go off 30 minutes before, I'm going to bed at midnight. I'm going to start going to bed at 11:30. Start slow. Do something that you can actually stick with. I think that's very, very important. So I would say, look at your lifestyle, where you're at right now, figure out which area do you have the most need. Sometimes when I meet with my patients, it is literally, Kristen, I do not drink water. I can't tell you how many people tell me they don't drink water at all. And I'm blown away by this. I'm like, you don't drink any water? I was just at the girls' weekend and one of my friends, I'm not going to say who it was, but she was like, I do not drink water. I drink coffee. And that's
goodness.
And I was like, how are you functioning? How? So, you may look and be like, I'm just going to start drinking water more throughout the day and really focus on staying hydrated. Because I don't think there's these, magic tips or tricks that are going to change who you are, make you a different person tomorrow. You have to figure out where are you lacking and what can you do consistent. So consistency is really key. And you probably have also heard the consistency, not perfection. I think that's a huge thing to remember when you're on your health and wellness journey is little by little, little becomes a lot. You have to pick something you can do 80% of the time or you will never see those improvements. So I think if we can simplify, we can drink water, go to bed a little bit earlier, get exposed to natural light first thing in the morning, eat at regular intervals, don't do crazy intermittent fasting, don't cut out major macronutrients forever. Don't feel like more is better. It's not always more is better. Sometimes less is better. So, maybe say no to all the things over the weekend and have a slower day to recharge. But I think it does, these tips and tricks, they look different depending on the person. But I can guarantee if all of you guys in here look at your lifestyle, you will be able to figure out which of the areas are you not doing as well. And figure out one thing you can do in that area starting today to make you a better person tomorrow. Maybe it's like you sit at your desk all day long and you don't exercise. Maybe start going for a 10-minute walk. And that is your thing that you're going to start doing today. Right after you get off this live, you're like, okay, I'm going to go for a 10-minute walk in this humidity. But just choose these things that you can do and stick with.
I love that. Yeah, no, we especially in my Well Balanced program with my friend Jessica, who does the therapy at angle, it's always progress, not perfection. And again, like the foundations are so key. We're so gung ho on these supplements and this whole, every deep protocol, and those are very helpful. But at the end of the day, if you're not getting the foundations in place, you're not going to see the results that you're looking for. So,
and if you're taking supplements whole life, that's also not getting to the root cause.
right.
It's like we have to look at all of this. Like, in my opinion, in functional medicine, we can't just put you on 20 supplements and expect change and do anything better than conventional medicine. We have to take the time to find out what is the root cause. And most of the time, lifestyle is a huge variable.
Absolutely. And I think the biggest thing is you have to put in the work. You have to be willing to put in the work, because it's not going to be easy, but it will be worth it, which I think is always a good perspective. Okay, well, that wraps up the conversation. I loved having you. This was awesome. And I just want to finish with where people can find you. Definitely, obviously, the Atlanta folks with Stat Wellness, and just kind of where, they can get more information.
Yes. So my handle is Dr. Kristen Oja. And so you guys can follow me there. I don't post as much. I'm like on an Instagram burnout. So you don't see me on social media as much anymore. I'm trying to get better in July. And then Stat Wellness is my business. And we have 2 locations, our Atlanta location and Roswell. So if you live nearby, come and tour them. They're both so cool and
They're amazing.
Our Atlanta's our West Side industrial feel, and our Roswell's our historical little house. Our little house, we call it.
Oh, it's so cute. I don't need to get by there and do an IV or something, but
yeah, it is.
That vibe is so cute.
It's the waiting room. It's original hardwoods from 1850.
Wow.
Original fireplace. You get your IV in the IV apothecary, so you're sitting in this big leather winged chairs. So yeah, it's great.
I love that. I go to Kristen whenever I need those kinds of things done, and she's amazing for those of you listening. So I highly recommend, and continuing to follow along with your journey. Do you think Stat Wellness is going to go nationwide soon?
I hope so. Exciting news that hasn't been formally announced, but my husband's coming on full time. His last day of work is on Friday, so he'll be
Wow.
and so hopefully he's going to help us with our growth plan, because we've got a big plan. So.
You do. You have big dreams, and you always make them happen. So I love following along, and that's exciting. Congrats to him.
Thank you. It'll be a big adjustment, but we're super excited about it. So his official first day is on July 5th, Tuesday.
That's awesome. That's awesome. Well, congrats.
Yeah.
I will definitely be back soon. Yes, and thank you so much
for
too.
tuning in. And you guys get to see me au natural, no makeup or anything. I realize should have probably.
You look great.
Hey, I love it. You said it was casual. It's like, all right, cool. I'm hopping on as is.
It's so chill. Yeah. No, I appreciate this so much, and I'll post this to my feed for anyone that wants to watch. But I hope you have a great day, and I'll see you soon.
Too. Thank you so much for organizing this. And bye, guys.
Bye.